Welcome to New Hampshire's Business. I'm Fred Coker. New Hampshire businesses have weighed in on a $3.1 million state-of-the-art child care center in central New Hampshire, a place where parents can put their toddlers and young children while they go to work. This comes at a time when there are fewer licensed child care centers in New Hampshire. Here are the numbers. Licensed facilities in August this year, 717. But look at licensed facilities in August last year, 756. Licensed exempt facilities, August 16 has remained constant. Now here's some good news. That's why this 8,400 square foot expanded and state-of-the-art child care and early childhood education center in Plymouth is so important and could be a model for other parts of New Hampshire. It's a project by the Mid-State Health Center in Plymouth that has brought together all the pieces required to expand an existing small child care center that will now serve more working parents with toddlers and preschool children in Plymouth and the surrounding area. And it's worth saying that has support from 10 New Hampshire businesses, Grapponi Auto Group, Bank of New Hampshire, Agnost Companies, Woodsville Guarantee Savings Bank, Northway Bank, Orchard Medical Management, Apple Therapy Services, Meredith Village Savings Bank, Littleton Region Healthcare, and Plymouth Rotary, also supported by the Community Development Finance Authority and Senator Shaheen. With me to tell us how they brought this all together to create this sorely needed child care center in rural central New Hampshire is the CEO of Mid-State Health Center in Plymouth, Robert McLeod, who leads the Primary Care Community Health Center. Welcome.
Thank you, Fred.
Nice to have you. I think I know your answer, but when somebody asks you, why did you do this? What did you say?
Because this is something that's very important to our community, and we felt we have the ability to do this. Childcare in this area is very important. There's a lack of it, and we thought we could step up to the plate and produce a wonderful building, which we did, in a program that will have a huge impact on families in this catchment area.
The three issues facing child care in New Hampshire, as you know, have been availability, the cost, and keeping staff who are paid enough to stay. You created the availability. How are you making this affordable, and are you paying wages to staff that will attract and keep them?
Well, first, we're making it affordable by bringing in families that are low to moderate income. 51% of our families have to meet that criteria. The remaining, obviously, can be of a higher income level. So we think that's very important because a lot of families that need childcare are those that can least afford it. In terms of sustainability and recruitment, we feel we pay our associate teachers and our teachers a fair market wage. And in addition to that, they get all of the benefits that every other employee at Mid-State Health Center gets, which is insurance, earned time, pension, and all the other benefits that are important to staff.
Yeah, that sounds really good. I understand you have room for 60 children initially, but you have requests from over 100 on a waiting list. Do you foresee more expansion?
Well, in fact, we have 160 people that their families want their children to get into Little Antlers. And of course, we'll have a capacity of a little north of 60 once we're fully operational. Because we're an 8,400 square foot facility, if we can get the staffing, we can be licensed to up to 100 children, ages 0 to 5. 0 to 5,
right. I think and I was there for your ribbon cutting, as you know, and I think having seen your facility, I think you've got a model that could be replicated around the state, Robert. So my thanks to Robert McLeod, CEO of Mid-State Health Center in Plymouth, for his briefing on what could be a model child care center in New Hampshire. And if you missed part of this briefing, you can go to WMUR.com, where it will be posted later today and all this week.